Thank you very much, Sally Ann, and it's a pleasure to be able to represent the Australian Party here today, and also to be able to address the 48,000 members of the QNU. I think we've seen in a 5-minute speech, of course, we don't want to concentrate on the negatives, but I think what we should be doing is concentrating on what we can do. In fact, I also would like to acknowledge the candidates for Buderim, Lynette Bishop, who's been a member of the QNU for 30 years as from next year, and also John Matheson, who has been a registered nurse since 1983 and specialises in mental health. He's the candidate for Condamine. Thank you very much for coming. I think it's about time that, I think one of the misconceptions about politicians is that the public assume that politicians know a lot about everything, but the reality is we know a little bit about a few things. And one of the key things in the political world is representation, whereby you guys, the 48,000 members, present to us, we represent that then to the Parliament. And I think that's where therein lies the biggest disconnect we've seen in politics, particularly in the last 10 or 15 years on all levels of government. Health has been a topic of hot debate for the last 20 years in the household. I was one of 9 children. We had 4 chiropractors, a nurse and 2 doctors, so you can imagine the conversations that took place. I ended up being a politician, but someone had to draw the short straw.
You must be very healthy.
Very healthy indeed. And but what I think we've seen, and we released our policy, the Australian Party released our policy 8 days ago in the Renew, Restore and Reinvigorate the health system. And what we need to understand is that we've seen, in the last 10 years, some 45 maternity wards closed down. We've seen a centralisation of services. And I think it would be fair to say that the government has become its own worst enemy in terms of the bureaucratic nightmare that we've faced and we've seen in recent events, but also the fact that you're looking at a ratio of around 5 bureaucrats to 1 nurse or doctor by the bedside, and I think that should be the reverse, to be quite honest. That ratio should be the reverse. It should be 1 to 5, not 5 to 1, and we've seen huge amounts of money being spent across the state. Mount Isa, $67 million revamped in the hospital, not 1 extra bed. So what we want to do is also provide incentives for the nurses in terms of their training qualifications. A couple of the points: to ensure patient and nurse ratio is maintained at the most effective level, to promote and encourage the career opportunities and professional development that is directed to clinical outcomes and direct healthcare delivery, to reduce the burdensome and excessive and unnecessary red tape, administrative process and paperwork, to focus on expansion of midwifery services throughout the state, paying particular attention to rural and remote areas, and provide incentives and programs for rural and remote nursing with necessary training and educations. And I think we've got to get this mindset out of the way, once government starts having a philosophy of centralisation, then you have, of course, the ripple effect, and as we all know, a fish rots from the head. So, of course, if you get it wrong at the top, the ripple effect for that can actually completely demoralise the whole culture of the nursing sector. And we've seen that of many nurses, particularly with what we've seen in terms of the payroll debacle was one of them. That's sort of the culture and the morale of the nurses on the front line, who are doing one of the most important jobs in terms of maintaining people's dignity in the health system, is absolutely critical. Because I can tell you now, if the politicians if our pays were cut within 24 hours, you can rest assured that would be fixed. So I think we needed something as simple as putting the checks in place, but we've got to make sure that we simplify these systems and make sure that the morale and the culture in the nursing sector is at an all-time high, because they have got huge potential. We're reaching exciting times, and I believe we're on the threshold of a new political era in both state and federal politics, which will provide enormous opportunities for the QNU to have input in terms of the direction, because the last thing that the 48,000 members of the QNU want to do is to be told what to do rather than advise us what should be done. And I think if we get that connect right in the first place, I think you'll have far better outcomes, and you'll find the nursing sector can indeed reach its potential and lift the morale right across the board. I think also we have to make sure that a lot of qualified nurses end up getting stuck in the admin and logistics of it, and what we need to do is make sure that we can streamline the bureaucracy, cut the red tape, and make sure that the nurses who have put their hand up to do the job are empowered to do that job. And I think until we have that mindset, that these nurses that of course often... 1 minute to go? 30 seconds, wow. Politicians can talk, can't they? So obviously we have a health budget that's in excess of $11 billion. So there is no excuse. There is no excuse for some of the things that we've seen, particularly in the last 3 to 5 years in the health sector. I will also say that we need to also recognise the unique role of the nursing within the health system, the only professional system that provides 24-hour continuation of care. And I think that's something that all politicians from all sides need to bear in mind. And I think we look forward to renewing, restoring and reinvigorating. And as Dr. Richard Kidd said, we don't want any Band-Aids solutions. We want a long-term strategy to improve and empower the nursing sector.
Thank you very much, Aidan. Thank you.